Treacher-Collins syndrome, a presentation by Angela Procopius. Before beginning the presentation, I'd like to share a wonderful resource. This is the book titled Wonder by J.R. Palacio. It is a wonderful book that does include individuals with Treacher-Collins syndrome, but more importantly, it gives educators a perspective that they may not have, the perspective of the child with the disability. And in this case, perspectives of family members as well. It is a book that I recommend to special educators, general educators, parents, and just people in general. It is a wonderful resource, and again, I appreciate the perspectives of family members and individuals with a disability. Treacher-Collins syndrome was named after Dr. Edward Treacher-Collins, who was an English ophthalmologist and discovered the syndrome's essential features in 1900. The name simply means that there is abnormal development in the lower jaw and the face. Treacher-Collins syndrome is a hereditary condition that primarily affects the structures of the head and face. This syndrome can develop as a mutation during the embryo's development in the time where the face and skull are forming. The face and skull form incorrectly. Another way it can develop is by inheriting the trait from one of the parents, and parents that have the mutation have a 50% chance of passing it on to their children. Treacher-Collins syndrome is a condition that affects the development of bones and other tissues of the face. It is estimated that it affects 1 in 50,000 people. The signs and symptoms of this disorder vary greatly, ranging from almost undetectable to severe. Some signs may include underdeveloped facial bones, particularly in the cheekbones, and a very small jaw and chin, eyes that slant downwards, and sparse eyelashes. Another characteristic may be cleft palate, when a child is born with an opening at the top of the roof of the mouth or a split top lip. In some severe cases, the underdevelopment of the facial bones can restrict an infant's airway, causing life-threatening respiratory problems. In other cases, Treacher-Collins syndrome includes vision and hearing loss. Hearing loss is due to the underdevelopment of the ear canal. Individuals with Treacher-Collins syndrome typically have a normal intelligence and attend general education schools and classrooms just like their non-disabled peers. In the following sections, we will cover the impact of this disability in other domains, such as behavioral and emotional development. Impact of Treacher-Collins on communication. Communication of students may be impacted due to cleft palate, facial muscle abnormalities, decreased oral cavity dimensions, or having a smaller mouth, and also tooth abnormalities. Early intervention is key for young children with Treacher-Collins syndrome. Speech and language supports and services should begin as soon as possible, and they will typically continue into elementary school. Impact of Treacher-Collins on physical development. As stated before, individuals with Treacher-Collins syndrome have abnormalities in their face and bone structure. There are no physical limitations for students with Treacher-Collins syndrome in school or at home. There may be some barriers, which may include recovery time after surgeries or procedures. So if a student has had surgeries to repair the bone structures, they may have limitations in school. This may include physical education or day-to-day activities for children, especially at younger ages. Impact of Treacher-Collins on social and behavioral development. Social and behavioral development in adolescence has its own set of challenges in general. Every middle schooler has to go through some kind of challenge, whether it's bullying, whether it's making friends and establishing relationships, or something similar. Having Treacher-Collins syndrome, it's important to teach the child or the student to have a positive outlook. They have a unique set of challenges that other middle schoolers, in this example, don't have. One example that comes to mind is from the book Wonder. In Wonder, the main character, Augie, is reintroduced into his general education school after being homeschooled for a long time. One of the challenges that he faces is bullying, mostly because the students didn't know or have exposure to Treacher Collins syndrome before. And being a typical middle schooler in general, having its own sets of challenges, Augie had to face those challenges in addition to looking different from all of his peers. He had a great opportunity to teach others empathy, but also be an advocate for himself and others that are different. Impact and consideration for self-determination. Teachers working with individuals with Treacher Collins syndrome can model expected behaviors for self-advocacy and support students in their daily interactions. One way teachers can support self-determination is by providing a positive role model or a mentor for a student. Instead of protecting the student, teachers can also help model problem-solving and conflict resolution skills, which is actually an important skill for all students to have, but imperative for students with disabilities like Treacher Collins syndrome. Educational adaptations to support education. If the student has hearing loss, the teacher should familiarize herself with cochlear implants or other devices such as FM directional microphones. An FM directional microphone helps reduce the effects of background noises, since the teacher wears a small microphone connected to the student's hearing device. This allows the student to hear your voice very clearly. In addition to access to adapted materials such as closed captioning for videos or access to headphones for read-alouds. If the student has vision loss, provide access to large print books or magnification devices. When using technology, adjust the color contrast. Educational adaptations to support social skills and self-determination. Social skills and self-determination have commonalities such as the need to practice skills first, then apply them to situations later. For example, it is socially appropriate to look at a speaker when engaging in a conversation. A student with Treacher Collins may be anxious or nervous to initiate a conversation with someone because of the need to make eye contact. One way to facilitate this is to give the student tips and tricks on what to do if they're getting anxious in a conversation, what to do and how to make proper eye contact, and what to do if the person doesn't make the right choice as they're engaging in the conversation. Educators should allow the students to take risks by providing a safe environment to practice those risks beforehand and to be accepted by their peers. It is essential that students are able to participate in activities, field trips, or extracurriculars just as their typical peers. Educational adaptations to support behavioral and emotional needs. One adaptation within the school environment is as simple as common language and expectations for all students. Some schools have PBIS, or Positive Behavior Intervention Systems, where there is a clear expectation for all students and common language is used. In schools that have students with various disabilities, in particular Treacher Collins, it is imperative that common language and expectations are set up for all students. Again, this benefits all students, but is essential for students with certain disabilities, such as Treacher Collins. When there are common rules in place that all students are expected to follow, for example, respect one another, no special treatment needs to be implemented for anyone with a disability or physical difference, in this case, a difference in appearance. Educational adaptations to support communication. Most students with Treacher Collins syndrome have access to speech and language services. Other than speaking, another thing that students will practice is their ability to chew and swallow. Due to the changes in their bone and structures in their jaw and muscles in their face, students may need to learn how to chew and swallow safely. This will be supported by the speech and language pathologist. In the classroom, there are options for nonverbal communication if the child is not able to communicate post-surgery, for example. This may include gestures, visuals, pre-recorded responses, or a scribe. One way this teacher can facilitate pre-recorded responses is to have the class answer in a typical way consistently and have these answers pre-recorded. By providing access to these pre-recorded nonverbal communication things, students will have a seamless transition back into the classroom after procedures and still be able to communicate with their peers and be an active part of classroom discussions, activities. Impact on family. Families can face challenges too. Some of these challenges include stress, stigma, worries, and financial burden. Families may be stressed or feel stressed because of the low incidence of this disability. Chances are families don't have another person with Treacher-Collins syndrome that they can use as a resource initially. Another impact would be stigma. Generally, people may not be aware of the disability. They may pass judgment or give looks that are inappropriate. This can cause a lot of stress on the family as well. Additionally, there are worries that include health concerns and just the unknown of a low incidence disability. Finally, there's financial burden. Surgeries and therapies may cost the family a lot of money. For all of these reasons, family support is critical for the child with Treacher-Collins syndrome and for the family.